Let's go ahead and finish off our discussion of tuberculosis that we started earlier in class today. We said that primary TB refers to the initial infection of alveolar macrophages, and it forms small hard nodules called tubercles in the lungs, and it's detected first by way of the tuberculin skin test, which you can see this little red bump here, indicates that this individual has been exposed to TB at some point. Now, that doesn't necessarily mean they have the active disease, because as we'll see in a minute, TB can be latent, but they have been exposed at some point, or they lived in a country where tuberculosis vaccines were given, because the vaccine will make it look like you've had the disease as far as the test is concerned. If someone has a positive test, then we do a chest x-ray and we look for tubercles. If we see tubercles, then we get a sputum sample and we do an acid-fast stain, and if we see red bacilli in the sputum, then we give that person a diagnosis of primary tuberculosis. This is an active form of tuberculosis. They are contagious. They are generally very sick and weakened and need to be treated. So some facts about tuberculosis. It is in fact most common in children, especially primary TB. It is transmitted through respiratory droplets, so talking, coughing, sneezing. It has an infectious dose of 10. So ID 50 means infectious dose in which 50% of the time it would cause disease. And the ID 50 value for TB is 10. That means it takes only 10 cells, which would be about one respiratory droplet from someone who is infected, to actually cause an infection 50% of the time. That's an extremely low ID 50 value. So by comparison, for you to get a gastrointestinal infection from eating, let's say, salmonella in undercooked chicken, you're looking at an ID 50 value of about 10,000. Okay, so this is a very, very low dose that's required to actually cause tuberculosis in someone that inhales one of these respiratory droplets. If it goes untreated, it has a very high mortality rate. 50% is extremely high. No one wants to face those kinds of odds. But fortunately, in most of the world, we are able to treat TB and not allow it to realize that high mortality rate. So it has a high mortality rate, but it has a low disease rate. And what that means is that only about 5% of everyone who is exposed to TB or actually inhales these respiratory droplets will get active disease. Only 5% of infections lead to active disease. The other 95% are latent, and we'll talk about that latency on the next slide in just a minute. One of the reasons TB is so difficult to eradicate once it becomes endemic in an area is that the bacilli, because of that waxy coating around them, can remain viable in dried respiratory droplets for months. Now, they don't form endospores, but they can sit around dried on a door handle, in linens, in clothing, literally for months. And it takes some real intentional cleaning and hygiene practices to make sure that it doesn't spread. Those tubercles in someone's lungs can remain dormant for decades. Someone could have been exposed to TB, developed tubercles in the lungs, and no sign of active disease. Maybe they develop it when they're 6 years old living in India, and they don't develop disease until they're 65 years old living in Boston. And that's the idea of latency. Most cases of TB infections remain latent, meaning there's no illness, the patient is not sick, and the patient is not contagious. We don't need to quarantine them, don't need to keep them out of school or out of work. They are not shedding the TB bacilli in any of their respiratory droplets. That's the vast majority of TB infections. Now, when our defenses are down due to a physical trauma or a weakened immune system, then those tubercles can reactivate. Often what happens is a tubercle ruptures. They can reactivate and lead to what we call secondary reactivated TB that we'll talk about on the next slide. There are many people throughout the world who would test as TB positive and can live their whole lives without ever developing active TB disease. So it is not a death sentence by any stretch of the imagination. But look at this last statistic. The World Health Organization estimates that over 2 billion people, about a third of the world's population, is TB positive. That is just a remarkable number. You could make the argument that this may be the most important pathogen on planet Earth that human beings need to deal with. You want your life to count for something, getting into tuberculosis epidemiology or medicine would have a huge, huge impact on literally a third of the world's population. So 95% of all TB infections remain latent at any given time, but they can reactivate when a tubercle ruptures, reestablishes an active infection. It's most often caused by weakened immunity. So when is your immune system weak? Well, it's weak when you're sick. It's weak if you're on immunosuppressive drugs to allow something like cancer chemotherapy to work. It's weakened if you are HIV positive and you have active AIDS. There are a variety of times when our immune system is weakened, and if someone is in latency with tuberculosis, they run the risk during that weakened state of it reactivating. And that happens most often in the elderly, but it could happen to any TB positive person, honestly, at any time in their lives. Then the final category is called disseminated TB. In the old days, it used to be called consumption, or miliary TB, or extrapulmonary TB. Fortunately, this happens very rarely nowadays. 1 to 3% of active cases will progress to this stage of disseminated TB. In most cases, we're able to intervene with treatment much sooner than this happens. But what's going on here, remember, tuberculosis, primary TB, is happening in the lungs. But those tubercles can rupture. Those bacteria can get in the bloodstream and then spread to other sites. Sort of analogous to a cancer, like a tumor, metastasizing and spreading and lodging in other places and establishing new tumors. In this case, the TB bacilli rupture from their little encasements called tubercles, get into the bloodstream, and spread to sites like bone marrow, spleen, kidneys, liver, and the central nervous system. Disseminated TB, there's very little we can do at that point. By the time someone has consumption, it literally does consume them, and it's very difficult for us to be able to treat that, and very rarely does anyone survive when TB has advanced to this stage. So as always, I suggest you go through this a couple of times. Make sure that you are comfortable with the material. Ask any questions well in advance of the exam if you get a chance to, and I hope this was helpful. I'll see you guys at exam time.